I'm Dr. Tara, and this is Hopeful Hints, a podcast where you'll receive quick, hopeful hints on all things women's health and infertility. Here, you will find education, inspiration, and most importantly, find peace and empowerment as you walk through the next steps in your healthcare journey. Welcome to Hopeful Hints. I'm your host, Dr. Tara. And I am so excited for today's episode on peptides. What are they? What do they do? How do they work? Who are they for? All of the things. And we're going to go over that. But to keep the conversation going, you can find me on social media at Dr. Tara Harding on all the channels. Reach out, say hi. I am always willing to work with patients, or if you're local, just know that all of the Simply You Wellness staff is trained on this. So let's dive in to this peptide conversation. I just want to begin by saying I'm also on peptides. So I'm taking these personally, using them personally for fertility and other things. And so it's been, I'm 2 weeks into this at time of recording and so excited about what I'm seeing so far. So let's start out with, what are peptides? What do they do? Peptides are short chains of amino acids, and they are named, and what they do varies by how many chains are in them. I'm going to try to keep this as second grade science level as possible, but they range from 2 to 50 amino acids in length. And what they do is they serve as a biological messenger in the body, and they play a vital role in regulating various functions of our body, including hormone production, our immune system, tissue healing, metabolism. And unlike pharmaceuticals that force the body into a specific reaction, peptides enhance the natural process of the body. And they really help the cells function at the cellular level in an optimal way. So that is why peptide therapy is actually considered safe, very targeted. So each peptide has a very specific purpose and plan. And I'm going to say right out of the gate that they have a very minimal side effect profile. They are, for the most part, for many people, very safe. So as I said, they act as messengers in our body, and they tell cells or give them a signal to carry out a very specific function. And they work by binding to receptors on the surface level of the cell. So kind of think of it as a key fitting into a lock. And when that key fits into the lock, it triggers a certain biological process in the body to happen. So maybe it's hormones to release. Maybe it's tissue repair to happen. Maybe it's a certain response in the immune system to happen. Maybe a metabolization optimization process. So each peptide, based on its number, is designed to target a specific function or tell a certain organ to do a certain thing in our body. And it makes them very precise and very effective because of that process that they have. So, example, there's a certain peptide that will signal the brain to release a reproductive hormone, which in turn helps fertility. Another one promotes healing by telling the blood vessels to grow and reduce inflammation. Again, unlike synthetic drugs that force certain things to happen in the body, it mimics naturally occurring molecules in our body to do their job. They have a very targeted action. And so they can be used for a really wide range of conditions. And we're going to talk about that in this podcast as well. So I got asked, this podcast is based on, I had a Q&A on my Instagram. So I do that often for podcasts. So make sure to follow along my Instagram at Dr. Tara Harding. I do a lot of Q&As and then turn them into podcasts to answer all of your questions. But why are they better or different than prescription medications was one of them. And I answered that just a little bit ago, but they differ from traditional prescriptions because they work with the body's natural process. So they're working with it versus overriding it or suppressing it. So pharmaceuticals often force a chemical reaction to happen or come with a really broad range of side effects. Peptides are natural occurring signals in the body. So they're a natural act to tell molecules to do something that the body is already doing and recognizing. And it uses communication that's already happening in between cells. So really can, again, do amazing things like help with healing, enhance hormones, not override them, but enhance them and regulate them.
reducing inflammation is a huge, huge benefit of peptides and improving the function of cells without disrupting the body's delicate balance that's happening. And that's what a lot of prescription drugs do, is disrupt a balance and override it and kind of take over and say, no, you'll listen to me and do what I say, versus working beside and working with the body. Also, traditional medications are synthetics, from synthetic hormones, synthetic steroids, they're anti-inflammatory drugs, and again, come with a lot of side effects. You're introducing foreign compounds into the body. So naturally, you're going to get side effects with that. Let's use the example of steroids. What this does is suppress the immune system and can actually harm certain organs, while synthetic hormones can actually lead to imbalances in the body too. So if we're talking about hormones, if you look at the studies that were done with hormone replacement therapy, they were all done on synthetic drugs. They were not done on bioidentical hormones. So big difference when looking at hormone replacement too, which we talk a lot about here in the clinic. But peptides stimulate the body to produce its own hormones, do tissue repair. Again, just making it safer because of the nature of what they do and how they work in the body. They're highly selective. And so they're only going to work on a certain area, on the intended receptor that they're out there to work on, without affecting the entire body and other organs and other body systems that they're not supposed to be. Remember, lock and key. So if it's not going to activate anything that it's not made to work for. Therefore, just because of that, we already have a reduced risk of unwanted side effects. A common issue with prescription drugs is that they're broad, they're not specific, so they're not lock and key. And we have, again, the full body systemic effect going on. The other really great thing about peptides is they're super customizable and they can be combined. So in our practice, we have protocols where we combine perhaps 3 of them to do something different than just giving you one alone. Again, depending on you coming for muscle healing and inflammation versus fertility, we can kind of work that. We have individuals that have torn ligaments and ligament repair and surgeries. Their protocol can be super customized versus our fertility patient population too. So it's really cool. And then we don't need to use multiple prescription drugs just to treat one symptom after another. We're going to optimize the body's natural pathway to restore its balance and function and just make it work better, make it work more effectively. So again, overall, peptide therapy is a very powerful tool, regenerative medicine, longevity, disease prevention, and it's really a low-risk alternative compared to pharmaceuticals. Let's take a look at how they're administered. So most peptides are administered via sub-Q. So think a small insulin needle. And what that does is allow them to enter the bloodstream quicker. They're also available in other formats such as oral, nasal, topical. So there is some other IV. We do some of those as well. So they do come in different formats. And let's talk about another benefit that we see used for. So some of you have heard, I got asked on Instagram about oxidative stress. Can it be used for that? They've seen this word be tossed around on social media a lot. So oxidative stress occurs when there's an imbalance between free radicals and antioxidants in the body. And free radicals are unstable molecules, essentially. They're kind of running around, doing their own thing, unstable. They are naturally produced, though, as byproducts of our metabolism or from external factors. Think poor diet, smoking, your environment, pollution, chemicals, things like that. And if we don't neutralize them with antioxidants, these free radicals can actually damage our cell's DNA, proteins, and our cells at the cellular level, which in turn, now we have inflammation. We have aging faster. We have diseases actually forming in our body. And so when oxidative stress is happening over a long period of time, years and years and years, even months, now we get premature aging, wrinkles, we get kidney disease, heart disease, diabetes, autoimmune conditions. All of these are inflammatory. We have hormone imbalances. Our estrogen's off, our testosterone's off, our thyroids are off. We have fertility issues, egg and sperm issues, and not able to conceive. Our embryo quality is poor. We even have something called neurodegeneration, and that's linked to brain fog, Alzheimer's, Parkinson's. So ways that oxidative stress happens, environmental, poor diet, excess sugar, processed food, but environmental, such as pesticides, pollution, things that we're over and over exposed to, smoking, alcohol, drug use, chronic infections, chronic inflammation. So if you are in an inflamed state or period for a long period of time, we see that happen. Emotional and physical stress. Yes, those things negatively impact our body when it is occurring over a long period of time. And then sleep deprivation. When we're not sleeping, our body is not well. So let's look at a few things that peptides can help with. The first one is fertility, and that is the reason I'm taking it, but also for inflammation in my body due to endometriosis and adenomyosis. And I got asked a lot of questions about it. We are going to talk about other things, so hang with us here, not just fertility, but let's start with fertility. So peptide therapy actually can play a critical role in helping with fertility care. Now, I actually ended up going with the fertility doctor that I chose because she brought forward bringing peptide therapy, and it was her idea. I was going to ask her about it, and she brought it up. I was like, you're it. Green light. Let's go. But peptides can help support our hormones. It can help with ovarian functions, sperm quality for my husband, and inflammation, and then egg quality. And all of these go together, obviously, for our overall reproductive health. Now, peptides help support menstruation. They can improve our ovarian reserve. So AMH levels can be improved with this in some individuals. And it's really helping lead to better egg maturation and ovulation. Even if you're going to go into IVF, you're trying naturally. And also they help, again, there's a big word, they help reduce our oxidative stress levels. They can enhance implantation and uterine health. Again, a reason I'm taking BPC 157. We know TB 500 can help reduce inflammation and improve uterine lining and receptivity, which creates an ideal condition, obviously, for implantation. And let's talk about sperm. So when it comes to men, let's first of all just say, men, we got to get you checked more. So many of you are not being checked. You're being told that your poor sperm is okay. It's fine. Move forward with IUI or IVF, and that's just not okay. So much gets placed on the female, and we really have to work on you too. So at Simply, we have a whole trained staff for male factor fertility, which has been wonderful. But peptides can boost sperm motility, morphology, and can improve chance of fertilization. The sperm is 50% responsible for success, is contributing to miscarriages as well. Now let's talk about conditions. So autoimmune responses or conditions that create inflammation. So PCOS, endometriosis, and the garbage diagnosis of unexplained infertility, all great candidates for peptide therapy. We were going to want to work on the immune system, inflammation system, and really just help improve the overall reproductive system. I always say, if you're inflamed in the body, your reproductive system is greatly impacted. It's not like it's over here off the side. Your mental health is over here. Your heart's over here. Your lungs over here. No, you're all connected. So if you're having physical signs, swelling, inflammation in your legs and your hands, puffiness, headaches, that's inflammation, and it most certainly is impacting your reproductive system too. Let's talk about some non-fertility situations where peptide therapy can be beneficial. So again, remember, because of the way they work with the body's natural biological process, rather than forcing an artificial change, these are really safe therapies for many individuals. And they can do a wide range of things. Autoimmune diagnoses can really benefit from this, metabolic health, or anti-aging. So if you're like feeling great, you got nothing wrong, and you're wondering if peptide therapy is for you, they are great anti-aging tools to have in your back pocket with your healthcare team. Muscle recovery. So think post-surgery, pre-surgery, any injuries to the muscle, really great for that too. They play a critical role in cognitive function. So think neuroprotective peptides for our brain. They can support brain health. They can reduce anxiety and enhance focus. And again, because they're highly specific with minimal side effects, they're going to be revolutionary. You heard it here first. Dr. Tara and the Simply You team, if you're local, you heard it here first with us, but they are a really great tool for functional regenerative medicine. And they offer just a nice, natural, science-backed approach. This is not like back alley medicine. There's a lot of science and research behind this. And so it's really fun. So again, think anti-aging, skin health, collagen production, improving your skin and wrinkles, tissue regeneration, think inflammation, autoimmune diseases, chronic inflammation, improve your immune system. Again, endometriosis, Hashimoto's, rheumatoid arthritis, gut health, gut inflammation. If you're having some gut issues, are great. Muscle growth and recovery. So again, improving strength, endurance, recovery, injuries, healing to reduce pain, weight loss, all of your GLPs, my friends, your trizipatides, your semaglutides, they're peptides. The lock and key that they have though, again, is targeted fat metabolism, weight loss, insulin sensitivity. And if you're someone, I already know what's going through some of your heads. Well, they got big side effects. Dosing matters. So a lot of those side effects are coming from the wrong dose or the wrong medication, right? Every medication, including Tylenol and ibuprofen, has a side effect risk. We just have to find the right key and lock system for you. And I'm going to use that analogy from here on out. And just a lot of the bad stories we hear and see are from dosing issues. All right. Brain health, cognitive function, mental clarity, focus can actually slow cognitive decline, reduce brain fog, and then gut health, leaky gut, Crohn's disease, IBS. Those are just to name a few of them. The ideal patient that these are good for is anyone looking to just optimize their health, recover faster, and enhance your performance. They can go alongside many other therapies. The key is working with a provider who's trained. All of our providers have advanced training and are always doing more training. We love our continuing education in our office. But again, I'm going to throw this back to men and women trying to conceive, people with chronic inflammation, autoimmune disorders, athletes, and anyone that's active that wants to improve their recovery, improve their endurance and performance. Those struggling with weight loss and metabolism, wanting to improve your metabolism, anti-aging, longevity, brain fog, cognitive decline. Any of those individuals are a candidate for this. And if you're unsure if you are or not, again, getting a consultation with a provider who understands the benefits of that. So again, how to get started if you're listening to this and you want to learn more. Obviously, my clinic, Simply Wellness, is a great place to start. Myself, we can do some consultations, but finding a trained provider who's actually trained in peptide therapy and that they are a nurse practitioner, physician's assistant, doctor of that level trained in this stuff, making sure they're using a high quality from an FDA regulated compound pharmacy. So our pharmacies that we utilize are all across the country. They're the top pharmacies that have had the right regulations in place and the right quality in place for this as well. Make sure it's someone who does baseline labs to customize your protocol. Make sure they're looking at you from a head to toe approach, not just here's your shot. Most certainly do not go to them if they are pulling up individual syringes and selling them to you. That is actually illegal. We see that happen a lot. If you're not getting the vial, that's your vial with your name on it. You should never be buying syringes of medications. And then avoid these nationwide buy online things. Make sure you're working with a provider who's going to look at you as a whole. Chances are if you're coming in for one or two things, if you're working with a really good provider, they're going to look at you and your whole body and take a really deep dive intake. I also got asked, why are peptides not readily available? Like, why is this something that's just being talked about now? Or perhaps you go to your provider and they don't know about it, or they start talking about them negatively, saying they're not FDA approved. Simply not true. So they're not readily widely available like traditional prescription medications due to regulatory restrictions. The pharmaceutical industry has an influence on this. Okay. So if they're not going to make $1 bazillion off something, it's really going to limit your awareness on something, lo and behold. And they have been studied for decades and they are recognized as effectiveness and healing and hormone regulation, all the things, but they're still, air quote, if you're watching on YouTube, considered experimental or investigational. And what that does is put this big FDA thing into place. And so just because something is not FDA approved does not mean it's illegal or inappropriate. It just means that the FDA isn't approved and insurance companies aren't going to pay for it. So these are compounds. You're going to have to pay for them on your own. And it means that they have been approved for specific medical conditions in some cases. There's just a lot of other unregulated things that we can use them for that the FDA hasn't given us their blessing on. And so again, work with a provider who's using a really high quality compound pharmacy. Another reason is the lack of pharmaceutical patentability. So peptides are naturally occurring. They cannot be patented. They can't be patented in the same way as a synthetic drug. What does that mean? Well, this means big pharma companies have little financial incentive. So literally what happens to them. So they don't have a financial incentive to invest in a large scale clinical trial that costs them millions of dollars for peptides because they cannot secure exclusive rights to them. So instead, most peptide research is actually conducted by individuals, functional med practitioners, regenerative health clinics. It's all of us on our own that would be doing the research behind this. And without widespread funding for something just to get the FDA's blessing, we just keep them non-FDA, keep them in a compound pharmacy, and there remains a gray area for many. I don't want that to scare you. There's a lot of misunderstanding. In fact, I did a reel on what FDA approval really means. And insurance is great to cover things, but these really are affordable for the most part. And we can do them over a few weeks, over a couple months, and have you come off of them, go back on them if you need it. There's just a lack of standardization behind the peptides too. There's been some misuse over the years in some populations, leading to concerns about it. Again, if you're working with a provider, they're not going to allow you to misuse this, and they're going to understand how they work. So again, I think the key is just working with a provider who understands it, understanding there's some barriers, there's some cost entry into this, but they are a rapidly growing area over the last couple of years. They've been around forever. They're not new. And sometimes not having the FDA approval, and it's okay. That comes with benefits too. It doesn't mean, again, if something is not FDA approved, I can't tell you how many times we hear other providers say, oh, the supplements they use are not FDA approved. Okay, come on. That's such a 1990 statement. Supplements don't need to be FDA approved. FDA approval means insurance pays for it. That's what, and a company has invested millions of dollars into a product with one symptom that they're going after. And long and short, I'll get off my rant about that, but they are revolutionizing health for people. I have seen personally and professionally the great things that they can offer. They're a targeted approach to healing, recovery, and optimizing. We love the word optimizing in our clinic. So they're looking to boost your fertility, reduce inflammation, enhance your athletic performance, reverse aging. I don't know. That sounds pretty cool, huh? Have a conversation, consider them. And again, just know that when you work with the right healthcare team, these are a great option for you. Thank you so much for listening to this week's episode. I'll see you back here next week on Hopeful Hint.